Hey, what's up, everybody? Maxwell's World. It is Saturday. I cannot keep track of dates. So this update, great news. Excuse the background. I'm not in my normal surroundings. Monday is top surgery. I've been counting the days. It's been rough. I was looking at a couple of pictures from my Instagram, or quite a few, and just comparisons of, I guess, the documented change. And I'm just we're here now. I just my brain isn't wrapping around it all the way. I'm talking about it, but it's I got one more day to go. And then it's when there's something I really want, and the anticipation of waiting for it, months to come or years to come or weeks to come or days to come, it's I get in this mode where I'm just sitting on my butt, resting on my laurels, watching the paint dry, just wishing time would go faster. Not really wishing time would go faster, but just all right, ready for this to happen, ready for this to be done. And this is something that I've been waiting for all my life. Then there were some moments in my life where I didn't even know I was waiting. Didn't even know it was an option. So when I was younger, before puberty hit and my body grew, I was free. I felt free all the time, inside and outside. But then puberty hit, and then I felt like I was clamped up. I was locked up. I was locked away. Because that's when my dad said, "Hey, you have to wear a bra now." What? Of course, it wasn't like that at all. But it's just a piece of me died when he said that. And it's just I can't explain it. And it wasn't a happy moment. I'm smiling because the day is coming of freedom again. Freedom I haven't felt since I was 7 or 10 or something, 11 or something. So young, and getting pinned down, man. And I didn't know the word transgender existed. I didn't know that was a possibility. I didn't know that was a thing. The only thing I knew that was out there was gay and lesbian. And that's a completely different category and topic, right? That's orientation. That has nothing to do with who you feel you are on the outside, and if your outsides and insides match. It's so complicated, and it's how could you even articulate those things at a young age? I was not articulating those things. Didn't have a name for it. It was feelings there, but it's so I just accepted what was handed to me. I accepted what society and civilization said. I accepted biology and science from the little amount that I knew. In the binary, this is what I'm talking about. And when I look back, I had met a couple of trans women at prides through a friend. She knew people, all types of people, and I didn't have a problem with transsexual women when I had met them back in the time when I was really ignorant, and it didn't really sink in on what was going on, even though I saw it and I was kind of told in a snippet what it was, and I could kind of see, not when I say it, I'm the process, not the people. When I could see it and told a little bit about it, it just didn't pierce me. It didn't resonate. It was just okay, that's what it is. And I wasn't bothered by it. And Like, that was that. And then I just am like surprised. And at the same time, not. Now that I'm completely immersed in my own truth and identity and journey and things, like, and considering where society is at with transgender people. But yeah, I just like, I was surprised I went that long in life, or this long in life, not knowing that there are things you can do to affirm who you are inside, no matter what it is you're identifying as. But more specifically, a person that feels male on the inside and not physically, that doesn't line up. And that there's options you can pursue to align yourself however you feel who you are. It just never came up. How would it come up though? But it just never came up. It wasn't something I heard about in my short time of living like that, except in Pride, and that was maybe 2008 or 9, maybe earlier 2000s. And I'm just like, dude. And I mean, at that time, I thought, I was a lesbian and things, because from diapers, I've always liked women. And with the lack of knowledge and information and role models or examples that it can be a living, breathing process and embodiment, I thought I was a lesbian. That's what made sense. I thought, like, LGBT. I never thought about what did the T stand for. That question never came in my mind. I was so focused on the L, the G, and the B. Like, it's so funny looking back. I was so ignorant. And, yeah, man, it's a trip. And so, graduating on to the other letters and community, and then the community LGBT, right? That itself is like a phenomena and uncanny, because we have our issues in every pocket, as I'm gonna call it, in every community in this umbrella of alphabet letters. And a lot of us in said groups don't always get along with other groups, or don't even support one another in the different groups. And that's what I've come to learn at the Trans Day of Visibility that I went to in San Jose, is it's not always supported between everyone, And actually, I mean, I can understand it to a certain extent, just in the sense of, like, each thing represents something different, and the way of living is a little different. It can be, like, because it's orientation and then what you identify as. So, yeah, being trans is way different from being lesbian or gay or bisexual, of course. Like, that's an obvious and a given to people that are in the community and some not. But not everyone knows this stuff, knows it exists, and if they do want to be educated or even hear about it. So there's that. And so, yeah, there's, like, I understand it also to the degree of just, like, if trans people want to be living stealth, or live as close as live as a heteronormative couple and things of that nature, then there's a disconnect. That's what I'm trying to say. There's disconnects between the communities for different reasons. Some internalize stigma and hate and judgment from hetero lenses and perspectives that's weeded its way through these communities, and then not, it's also just us, like, carrying whatever it is we're carrying as people and bringing that into the dynamic. But yeah, this is just a random update video. Like, my top surgery is on Monday. My aunt is gonna pick me up. I'm out in my hometown I'm at the family house right now. Um, and I'm gonna go on a hike tomorrow morning with a friend. That'll kill time. Like, I'm just trying to keep myself occupied. Because if not, I will just sit here in this room and play video games on my phone and listen to music. And that's not necessarily bad, but it's like, I will stay huddled up. That's what I'm trying to say. That was the beginning of this video. That was the point. I will stay huddled up and not doing anything. Just, and that's not good. That's not good. So I'll go on the hike and also just try to take it easy and get good rest. And then go to my aunt's house, and kick back with her and try to go to sleep at a relatively reasonable time. My surgery's at 10:15. I do expect to get out at the same day, and she will take me to where the city I live now. And a couple of people I've asked have and also volunteered on like going grocery shopping for me and bringing me food and coming to visit me and things. And that's where I'm at right now. So, and then of course I'll figure out what supplies I need to get, because I haven't gotten any supplies, like when it comes to like scar cream or gauze, balls or bandages or any of that stuff, because I kept seeing, doing the research, that people were saying, but talk to your doctor. So I wanted to get the shopping list, like, okay, I need to get this, and I was like, let me not, because I don't want to buy a bunch of stuff I may not use or may not need. Let me wait till I get instructions from doctor. And then my testosterone shots, I think I'm up to 63, maybe. Regardless, I'm up there. So yeah, pretty much it was a year and some change it took to get to this moment right here. And what did that mean though? That meant working 7 days a week, which I do not recommend at all. But I mean, blood, sweat, and tears, ultimate sacrifice. Quality of life was turbulent, due to outside factors. My nephew who got killed, as you guys know, grieving that, mourning my own self, mourning pieces that are leaving and things that I'm letting go. A tremendous amount of letting go. And I really did my best, and doing still the work in the process of like letting go of things from my past that may have been holding me back internally, or that my mind still trips on, guilt or shame or anger or pain or whatever, towards people, towards myself, towards circumstances, towards God, whatever. Because I really want to step into this new chapter of my life as clean as I can. With that being said, there will still be things that are brought to my attention from my mind and subconscious memories and things I have to process and deal with and sort out. And an example of that happened today. My dad was talking to me about a particular man from our old neighborhood, and it just brought up a lot of stuff that I'm still angry about, and I have to work on it. And I was able to clearly communicate, hey, like, can we not talk about this person? Like, I'm still angry about a lot of stuff, and like, it's stuff I have to work on, but like, so I was throwing out things to throw out a boundary. I did throw out the boundary. It was not respected, but that's who my dad is sometimes, and I still love him, and he's just him, and he can't help himself. Yeah, I got upset. I got angry. And also, since what are the words? Since surgery, I usually take fish oils. That's what I use for my antidepressants. I don't take prescribed antidepressants, but I'm about to, because I have to. I need to. I just have had too much stuff come at me, and I am slowly building up my my armor again. A lot of things, but one last catastrophe kind of came at me, and it just knocked me off to a place to where I'm just like, All right, universe, I'm about full, bro. My cup is full, my bucket runneth over, and I can't hang anymore. So I need some extra support on top of already what I'm doing. But yeah, so I haven't been on my fish oil pills since last week, and also my valerian root, which helps with my anxiety. Um, and so that's made things a little bit interesting. But I say all this because um, so that means like my emotions are dampened, because I don't have anything that's helping my depression, because I do have that, chronic and acute because of life stressors. But so I'm a little bit more raggedy, and so when topics that anger me or cause a disturbance inside happen, it's a little bit stronger than it normally would. Supplements is what I'm saying. So that example was the dude that my dad was talking about. And like I have no problem like working this stuff out. This is stuff I need to work out in order to become a better person and to let go of baggage and not like have this stuff in the way of my life and like with other people, because I get really short, well, not short fused, but I get really short. I don't know how to put it other than that. Like my communication goes from like long to this because I'm still affected by holding on to the stuff that people have done to me, more specifically men. And I've worked a lot of that out, but there's still a few people on the list, and that's what that reminded me of. Like, oh, I need to work on that. And yeah. And so I don't know why I said that. I just said it had to come out, I guess. So this video, I'm a little tired, y'all. This video's gone pretty long, but I also just want to say, man, if you're on any type of journey, especially one that's you're changing in the person you are, and that means a lot of difference on the outside and the inside, keep doing it. Keep doing it. It's worth it. I swear to God, it's worth it. Like, I don't regret anything of this last year. I just would have did things a little bit differently. Probably wouldn't have had, because I had a lot of things going on, and I just kept going. I just kept going to work. I just kept suiting up and showing up, which isn't a bad thing, but like I just didn't give a chance for my emotions to catch up sometimes, or they'd be getting suppressed when I really didn't mean to suppress them. But at the same time, I've been hitting therapy, and I still hit therapy, and I still go to AA groups, and I still talk to friends, and I still, it's just wasn't enough pausing and rest is what I'm saying. So the quality of my life got really shitty at some points, mental health wise, mental wellness wise. And I'm human, and a lot of stuff has been eating me up on the inside that's not translated, and that's just what it is, man. And I'm proud of myself. I did the best I could, and I got me far, along with you folks that support me, and even you folks that don't support me or any of this or what I do. I don't really care for the ones that don't. That's fine. Still got love for you. And of course with the universe and stuff. So like, it could suck, it could hurt, but you can endure it, you can make it, you can do whatever you set out to do, So there's my pitch. I'm going to bed now. Until next time, hopefully the next video you see, I will be bandaged up and had surgery. So keep me in your prayers, please. That's all I can ask. All right. Mahoma Takoyasin.